Breaking news. Healthcare premiums in California are about to spike 65% to even 100% higher. And now California Democrats are blaming it all on Donald Trump. Coming up, I'll tell you what's really fueling the price spikes and what we're doing to fight back to save you money on your healthcare premiums in 2026. I'm Carl DeMaio, chairman of Reform California and a California state representative. And get ready, grab your wallet. Your health insurance costs are about to spike substantially higher in the state of California. California already has some of the highest healthcare costs in the nation. And we are the most generous state when it comes to government subsidies through state and federal sources. But the premiums this year are about to spike to consumers dramatically higher. And there are two things that are fueling this. I'm going to tell you what's going on and what we're doing to soften the blow and actually reduce your health premiums. But first, I need you to know that in California, whether it's the healthcare cost spike that I'm about to address or the price of gas, the price of housing, the price of your groceries, our cost of living crisis is uniquely driven by state and local politicians, not Donald Trump, not price gouging by big bad corporations. No, it's uniquely happening in California. The worst inflation rate happening here in this state, the highest cost of living happening in this state, not because of national trends or market manipulation. It's all because our politicians, Democrat, liberal politicians, they are the ones in charge with a supermajority. They've enacted the highest taxes, mandates, regulations, and fees in the entire country. They've created the crisis. But they're very clever at lying and shifting the blame to anyone but themselves. And as long as they're able to shift the blame, they don't have to reform these bad policies. And you won't see the savings. You won't see relief from price spikes. At Reform California, we're fighting to make cost of living the number one issue in the 2026 campaign. We believe that we have to break the Democrat supermajority on the issue of pocketbook problems, the cost of living in California being too high, and we need your help with that campaign. So check out what we're doing at reformcalifornia.org. We are exposing where the money is actually going. It's going to illegal immigrants, freebies, and welfare. It's going to waste, fraud, and abuse, political grift, campaign contributors getting kickbacks. We also are fighting specific tax increases. For example, the mileage tax that they're trying to apply. Part of our campaign is, again, to recruit, support, and endorse candidates for office so that we can break the 2/3 supermajority that Democrats have in the state assembly and state senate. And by doing that, we can balance out our political system. We can stop tax increases, and we can force important reforms, cost-saving reforms in each of these areas. But we can't do that without your help. So go to that website, check out what we're doing with the Reform California campaign. And at the bottom of that website, sign up. Your first name, your last name, email, phone, and zip code. That way you're tethered into the growing movement statewide to take back our state from the insanity of the far left. And please do consider a contribution while you're at it. Let's get right into it. The governor's office is out with this press release, and this is from the fall. Healthcare costs for many Californians will nearly double in 3 months because of Donald Trump. Orange man bad. Of course, you've got the governor trying to blame the price spikes that are all forecasted, by the way, on Donald Trump. He says that Donald Trump and Republicans are responsible for high prices of healthcare in California because they are withdrawing federal subsidies. Now, on one level, you can say, well, if you withdraw a federal subsidy, then who pays? Well, the consumer has to pay. But the question becomes, why do consumers have to pay such a high price in the first place? Is it the cost of insurance, Obamacare subsidies? Or is it the actual cost of a doctor providing a medical service? It's actually the latter. Insurance is nothing more than a mechanism by which we collect money to pay out healthcare costs, to provide healthcare coverage. It's not the insurance really that's the issue. they're just simply the tally of what it costs to provide healthcare coverage. The real cost driver, you guessed it, it's the cost of a doctor seeing you. It's a cost of an ER visit. It's the cost of an ambulance ride. It's the cost of an aspirin. You hear about the $10, $12 aspirins at hospitals that are being charged. Well, what causes it to be $15? Oh, sure, you can say price gouging. The reality is what the hospital's doing is to charge for that aspirin. They fully load all the regulatory costs of everyone, even the nurse that showed up and gave you the aspirin, all the cost of the lawsuits and everything. So it's all rolled up into the total cost of healthcare. So if you want to reduce premiums, you can mask the problem by getting the federal government to go into debt, raise taxes at some point, and just simply give freebies out. Or you can tell the states, do your damn job and bend the cost curve to make healthcare more affordable. So when the governor says the costs will double, no, what the consumer is going to be paying on the Obamacare exchange for premium subsidies, that will go up if state politicians don't actually bend their cost curve for the various medical services and healthcare programs that they administer. So let me get even more specific on these premiums, because your premium doesn't have to come up. I know in order to address the cost of healthcare in California, there's reforms that we have to enact. We have to slash the red tape and get rid of the mandates on our doctors and our hospitals and bend that cost curve. That might take time. So what do we do in the interim? I believe that we can actually provide state premium subsidies to stabilize what you pay for your health insurance, but there has to be that hook, that accountability mechanism that says state politicians are going to be given 18 months, 24 months to bend the cost curve for hospitals and doctors to reduce the price of healthcare in California. And in the interim, we're going to provide 18 months of health insurance subsidies so that the ratepayer, the consumer, doesn't have an impact in their premium. This is the California Republican healthcare plan. Our plan requires no increase in your premium. So what he's talking about here, healthcare costs will double. And by the way, the Obamacare exchange says it's probably going to be about 65% increase for people who qualify for federal subsidies right now, that when they lose them and they have to pay the full price of their healthcare, health insurance. Let me be clear about that. The difference between health insurance and healthcare. Well, there's an easy way to fix that. And I made this point on the assembly floor, and I'm going to play the clip for you in just a moment. We proposed that we eliminate the $13 billion of state taxpayer money being used to give illegal immigrants free health insurance. Take that $13 billion, and all it would cost is $2.5 billion of that. We'd have money left over, but $2.5 billion of the $13 billion, if you eliminate illegal immigrant free healthcare at taxpayer expense, that $2.5 billion would eliminate that 65% premium increase. Hell, let's give them 2 years of it. Let's take $2.5 billion times $2.5 billion for a total of $5 billion. Of the $13 billion, we're still going to save $8 million by eliminating illegal immigrant healthcare. You will have 2 years of absolute state subsidies on your health insurance. Now, in that 2-year period, politicians, you better get to work. Let me give you some examples. Here, we've got the Transparency Foundation with its Cost of California report. I want you to check it out. Go to thetransparencyfoundation.org. Top story, study shows living in California imposes a $29,753 cost of living penalty on the typical middle-class family. And it breaks down all of the costs for your household budget, including healthcare. They have 2 examples in there on healthcare costs, because look, our hospitals have all these regulations, mandates, charges, taxes, earthquake retrofits that other states don't require. And you also have nurse staffing ratios and overtime mandates and labor requirements and lawsuit requirements that all these healthcare providers are saddled with. Well, what if we just waived all that and said, let's just require what the typical state requires on all those items? We don't need to regulate more than what a typical state does, because Lord knows their regulations cost less and no one's dying in the street. So let me give you 2 examples of how this would save money. The average emergency room visit in California is $3,238 just to walk into the emergency room. In Maryland, it costs $682. Now, why is an ER visit, 5 times more in in California than Maryland? It's the regulations. You're not getting better care in California. Some would argue you're getting worse care. How about an ambulance ride? It costs $661 in North Carolina for an average ambulance ride. California, $2,407, 4 times the cost of North Carolina. Now, I understand that it may cost a little bit more in California than other states, but 4 and 5 times, bitch, please. That's not acceptable. This is something where your state policymakers have done so much regulation and taxation and mandates and confusion. Those requirements do not serve a good purpose for your health, and they should be reformed. Benchmark against a low-cost state, and you'll save money for everyone in healthcare. And then those premiums can be bent. They can be reduced, and we won't need government subsidies. That's not what Democrats are doing. No, they're going to use healthcare as a way of getting more of your money. Oh, that's right. LA County officials push new sales tax to offset Trump healthcare cuts. Orange man bad. Thank goodness we've got the boogeyman so we can steal more of your money. That's the translation of that headline. And you're going to see local tax increases, maybe even a state tax increase. You'll definitely see a state tax increase, all based on orange man bad. Donald Trump is a bad guy. And that's why what has to happen? No, Donald Trump doesn't have to be punished. No, you've got to give more of your money to these asshat politicians that created the problem in the first place. Rinse and repeat. This is the big fraud, and it's happening right before us. I mock the LA Times for being a tool of the left. They're just a propaganda piece. They're not challenging these politicians on, well, why does it cost 5 times the cost for an emergency room visit? Maybe you politicians should go fix that before you ask poor working families to pay more for all the products they buy in the form of a sales tax increase. These people are liars, thieves, and cheats. We have got to spread the word as to what's really happening in healthcare, why the costs are higher. That's where Reform California's campaign comes in. No one is doing this sort of work. No one's breaking down the numbers like we've just broken down, not just warning you of a premium increase, but telling you why and how we can stabilize things immediately by giving you state subsidies instead of subsidizing illegal immigrants. And then, of course, dealing with the root cause by bending the cost curve by benchmarking against lower cost states. We've got a plan. We just need your help to get that plan out there. And we get that plan out there when we fight for the good candidates we've endorsed in the November 2026 midterm election. Be part of that plan. Be part of the fight. Go to reformcalifornia.org. Sign up at the bottom. Chip in a contribution. Of course, like this video and subscribe to this channel so we can break through the censorship of the liberal media. Until next time, I'm Carl DeMaio, Chairman of Reform California and a California State Representative. Thanks for watching, and I hope you enjoyed this episode. But before you click away, please subscribe to this channel and click that notification button so you get updated when we post new episodes. Plus, like this video and share it with your friends so that we can help spread our message across the state.